The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. Welcome back to Daytime, everyone. Dr. Michael Jasin from the Jasin Facial Rejuvenation Institute is here to talk about looking your best this holiday season, and he's here to answer your emails. So here you go. You've got the questions coming in, and this is a question on a lot of people's minds, and it's about the lips. A lot of people want to know, I want fuller lips, but I do not want them to look overdone. Is there a way to achieve a fuller but still natural-looking lip?
Absolutely, and that's the way it really should be. No matter which injectable we use in the lips, it should be a natural look that doesn't look overdone and doesn't scream out to people that I had something put in my lips.
Right.
So I brought some examples of that to show you. This is a younger patient who wanted fuller lips, but you can see it's subtle, but we've got better definition, a smoother lip, easier to put lip liner or lipstick on. The next photograph shows a patient who had a little disproportion between the upper and lower lip. We balanced that out and brought them into better harmony and added some volume and fullness to the lips, but doing so naturally. And the next patient had a upper lip line that we treated, and we added volume more with the idea of adding definition to the edge of the border of the lip and also treating the lip line. So we can do that without necessarily making the lip look bigger.
And you're not using collagen as much anymore?
Collagen is kind of rarely used, especially in the lips, because the duration of action is so short. Most things last less time on the lips than they do elsewhere. So Juvederm is probably our most common lip product, but I also use Radiesse for people who want more longevity. Okay,
now let's talk about the quick and easy ways to look best for the holidays.
And the quickest and easiest things to do are probably the injectables. So that would include Botox to relax certain areas of the face and treat lines that way, or we can do injectable fillers to treat facial folds, lines, and wrinkles.
Facial folds. Let's take a look at our first subject.
This is a male patient who had very deep folds that we call nasolabial folds extending down from the nose to the corner of the mouth, and you can see this is immediately after treatment, and there's very little bruising, but we've got pretty much total correction there.
And treatment is really quick, isn't it?
It is. It takes 15 to 20 minutes to do an injection like that. Now, the next patient also had deepening of the nasolabial folds, but she had a product called Evolence injected, which is great because it doesn't cause much bruising, so you can slide it under the radar better.
So she could have that done at lunchtime? And
absolutely, we can.
Back at work in the afternoon?
We can. This patient had a technique called invisible touch where we've restored the jawline and gotten some definition between the neck and the chin.
That looks great.
And one thing that people tend to forget about is their hands. We know we take care of our faces, but we forget about our hands, which get kind of skeletonized as we get older, and that can be a giveaway as to your age. So this is a 5 or 10 minute procedure to fill out and plump out the hands, usually done with Radiesse.
And is it pretty painless?
Oh, we do that with no anesthesia at all.
That's wonderful. Yeah, the hands are a dead giveaway.
They are.
Okay,
they are.
Don't forget about the hands. Okay, next question. I have heard the term liquid facelift. What is it?
Well, typically that's going to be a combination of fillers and Botox. And what we'll usually do is use Botox to relax the upper face, and then we'll use a filler to volumize the mid-face in particular, maybe along the jawline. So we'd use those in combination to get a facelift type effect.
Is that what happens often as we age? Our faces get a little sallow?
Well, the volume shifts and changes, so we need to add volume to restore it where it used to be and where make it look better and not so old anymore. So
look at her.
This is a patient who had Botox for the upper face and filling for the mid-face and along the lip border, and you can see she has a facelift type effect. And the next photograph demonstrates that as well. We've done a little more extensive filling, some filling of the brows to get the brow in a higher position, some Botox for the upper face, some reshaping of the nose and the cheeks as well.
And when you're filling in the cheeks, how are you doing that?
Well, I use this patient's a great example of what we call our invisible touch technique, where we're doing the injections through the inside of the mouth.
Great.
And this is immediately after treatment for injection of the cheeks and mid-face, and you can see you really can't tell he's had anything done, so it's another way to get out without much downtime.
Wonderful. Okay, last question. I've always heard it takes several weeks to recover from facial surgery, and it requires general anesthesia. Is this true?
Actually, no. We do most of our procedures under local anesthesia, and we don't use general anesthesia for any of our procedures.
Really?
So if they need something more than local, we do a twilight sleep with some IV sedation, but probably more than half now are done under local. And this is an example of that. A patient who had a simplicity lift, which we've spoken about before, and she's also had some fillers to revolumize the mid-face. But this could potentially be a long weekend recovery. So even with the holidays coming up, it doesn't exclude the possibility of having a surgical procedure done to improve your appearance and not have it be known by the time the holidays roll around.
That is incredible. Wonderful job, and thank you for answering those questions for us.
Thank you.
And Dr. Michael Jasin of the Jasin Facial Rejuvenation Institute. We'll be right back. The preceding portion of Daytime was sponsored by the Jasin Facial Rejuvenation Institute.